Hello everyone, I am Christine Georgeshell and today I'm going to perform the hand washing technique return demonstration. Hand hygiene is regarded as a primary measure to prevent infection, and it is the single most important procedure for preventing the spread of microorganisms and therefore healthcare associated infection. Prior to the conduct of the procedure, first, ensure that the equipment to be used are complete. These include an easy-to-reach sink, antimicrobial soap, and paper towels. First is we have to remove our jewelries because microorganisms can lodge into the settings of our jewelries. Next is assess hands for hangnails cut or break in the skin. Next, I'm going to turn on the water and adjust the pressure. Now, thoroughly wet the hands and the wrist under running water. The finger should be always pointing downward and the hand and forearm should always be placed below the elbows so that the water flows from the least contaminated area to the most contaminated area of our hands. Now, apply a generous amount of antimicrobial soap and thoroughly lather hands by rubbing palm to palm in a circular motion. The circular action creates friction that helps remove microorganisms mechanically. Now, I'm going to rub my right palm over my left dorsum with interlaced finger and vice versa. And then rub palm to palm with finger interlace. Interlacing the fingers and thumb cleans the interdigital spaces. Okay, so now I'm going to rub back of my fingers to opposing palms with fingers interlock. Rotational rubbing of left thumb claps in the right palm and vice versa. Friction mechanically loosens microorganisms and dirt from the skin surface from soiled areas. Next, clasp the finger and rub into the palm of the opposite hand. Okay, so now rub the wrist. So we are done. We are going to rinse off our hands under running water. To turn off the water faucet, you can use a paper towel. This is done to avoid touching the faucet, which is a contaminated area. If we are touch it again, then we will have to do the whole process again. Now that we are done, we are going to dry off our hands using paper towels. Discard the paper towels and use another one. And that's it. This is the proper hand washing techniques. The use of lab gown, mask, eyewear, and gloves is to provide protection of the skin and clothing from incidental contact and small splashes, and to prevent the spread of contamination outside the lab. It also helps to minimize the potential skin exposure to hazardous chemical, biological agents, and other hazardous materials. First, wash your hands to prevent transfer of microorganisms from the hands to the gown. Pick up a clean gown and allow the gown to unfold in front of you without allowing it to touch any soiled area. Slide your arm and hands through the sleeve. Fasten the ties at the neck band to keep the gown in place. Overlap the gown at the back as much as possible and fasten the waist ties or belt. Overlapping securely covers the uniform at the back. Waist ties or belt keep the gown from falling away from the body and prevents accidental soiling of the uniform. Apply cap to head. Be ensure to tuck in hair under cap. Locate the top edge of the face mask. The mask usually has a narrow metal strip along the edge. Hold the mask by the top two string or loops to prevent contamination. Secure the lower edge of the mask under the chin. Covering the both nose and mouth will prevent the transmission of microorganisms because air moves in and out of the nose and mouth. And then put goggles or face shield. The use of the gloves reduces the risk of contaminating the healthcare worker hands, as well as it reduces the risk of the transmission of microorganisms and harmful pathogens from the healthcare workers to the patient and vice versa. So here I have prepared my sterile gloves. Ensure that the gloves are on the right size. Identify the left and right gloves, and for easier application, we must glove the dominant hand first. Grasp the cup of the gloves. It is important to remember that with bare hands, we can only touch the inside part of the glove to avoid contaminating the glove. So now that I'm done donning gloves on my dominant hand, next is my other hand. Slip fingers beneath the cap of the other gloves and slip to hand. Since both of my hands are now gloved, I can arrange the glove. We are going to clasp our hand in front of our body. Is done to avoid accidental touching of non-sterile objects. Now, to remove the gloves, all we have to do is to remove the gloves of the dominant hand by pinching the glove to the palm area of hand and remove it. And for the non-dominant hand, we are going to slip our finger under the glove or inside the glove and remove it. And now you can discard the gloves. And then discard the face shield. Next is discard the head cap. Dispose it on the proper receptacle. To remove the face mask, untie the first lower string. While holding the tie, securely remove the mask from the face. Discard the disposable face mask in the appropriate receptacles to prevent or lessen the transmission of microorganisms. To remove the gown, unfasten ties of the gown. Avoiding touching the soiled parts of the gown prevents contamination. Without touching the outer surface of the gown, fold it and discard. The soiled part of the gown is folded inside out to reduce the chance of transferring any microorganism. Then wash hand using hand washing technique.